Hello, I'm Dr. Don Bailey and welcome to HopeMD. I wanted to take just a few minutes to welcome you to the site and tell you a little bit about what we do here and how I came to work in energy medicine and energy healing. I am a medical doctor and I did family practice for about 10 years, a little over 10 years. And then I had some problems of my own regarding pain, fibromyalgia, herniated discs that were pretty severe. Very severe, in fact. And along with that, I developed some depression and anxiety, and I found that Western medicine really had nothing to offer me, and really had very little to offer the people that I worked with on a day-to-day basis with chronic pain conditions, and again, often associated with depression, anxiety, and other emotional states. So I started to look for other answers. And I started to read about energy medicine and energy healing, about meditation, about guided imagery, and I studied really everything that I could study. I really was desperate for an answer myself, but I was also really seeking an answer for people that I worked with every day. So I studied a lot of different areas of energy medicine. I studied matrix energetics, I've studied EFT, I've studied quantum techniques, I've studied a lot of different techniques, but the basic fact or foundation of what I do and what energy healers, I don't like to really use the word healer, but we do healing work, we help you to heal. The basic underlying fact of what we do is that we're all connected energetically. And the Chinese, of course, have known this for thousands of years. They talk about qi, the energy force that flows through everything in the world and everything in the universe and connects all of us. In India, they talk about prana, which is also like vital force. And again, it's an energy force that they've realized for thousands of years flows through all of us and connects all of us. And in the last half a century, quantum physics, Western science, has realized that, in fact, there is an underlying energy to the entire universe, and an underlying energy flow and movement of energy and light in all of us, between all of us, and that we are all connected energetically. Because of this, if I intend to do so, I can get connected to you energetically. I'm already connected to you energetically, but by intent, I can increase that connection to where I can literally start to get a sense of where your energy blocks might be, where your energy might be out of balance. This may be due to physical trauma, it may be due to emotional trauma. Frequently, people with chronic illnesses have some emotional traumas, usually in the first 5 years of life, and we can uncover those. If you think about acupuncture and understand, most people know about acupuncture, and a lot of you have probably had acupuncture in an attempt to relieve pain and other conditions. In acupuncture, what the Chinese medicine doctor is trying to do is to determine what those blocks are in the flow of energy through your body in channels that are called meridians. And by inserting needles, redirect that flow or balance that flow. And again, the definition of health in Chinese medicine is balanced energy, and that's really my definition as well. So you can think about acupuncture and the insertion of needles into different areas of your body that may be at a completely different point. Your pain might be low back pain, but they might take a needle and place it into your foot because everything is connected in the body. Well, a step beyond that is acupressure. And in acupressure, you're simply applying pressure to an area that is related to a meridian or an acupuncture point. And then there's acutapping, also known as EFT and developed by Gary Craig. And in acutapping, we're not putting needles into these points, we're not applying pressure, we're simply tapping on these different acupuncture points in a kind of a systematic way, and they go down to the body and down into the hands. There's specific ones on the hands. And if you search EFT, you're going to find a lot of sites, a lot of excellent EFT practitioners, and manuals on how to do EFT. And you can go to Mercola.com, the largest alternative health website in the world, and he talks about acutapping, or EFT. So if you can imagine this step, which is that I'm talking to you at a distance, because most of the work I do is distance work now. I don't have to be face-to-face with someone. I don't have to lay my hands on them like I did as a physician. I can just get connected to them energetically and start to get a sense, and a lot of what I do is intuitive, but start to get a sense of what's going on with you. Why are you not feeling well? What are the imbalances? What are the trapped emotions maybe that are there? What are the traumas that you're reliving day in, day out? What are those things, and how can we release those and get you back to optimum health? So when I'm talking to you on the phone, and I have clients all over the world. Today I talked with somebody from Australia, from someone from Dubai, the United Arab Emirates, and several people in the United States. When I do that, what I'm able to do is to energetically connect with you. We're already connected, but the connection becomes deeper, and my intent is to do that and kind of become a proxy for you. Put myself into your shoes, so to speak, so that I can test and do muscle testing to determine where the problems are. Now, maybe we'll decide that EFT is the way to go. And you may not have to do any tapping at all, because if I put myself into your position, I can then do the tapping for you. In other words, let's say we're looking at depression or anxiety or panic attacks. Okay, we can focus in on that, and then we can tap on these acupuncture points, okay, with the intent of relieving that depression or relieving that anxiety. Now, there's lots of other modalities that I use, and again, based on my intuition, I can ask the question, and with muscle testing or kinesiology, I can ask, would you be best served by EFT? Would you be best served by releasing some emotions? Would you be best served by matrix energetics or quantum techniques or these other energy healing modalities that have been developed by some very bright people? And so we can start a dialogue, and that's what I do first, is I just simply talk to you, find out what your concerns are, what your problems are, do some testing, and find out, okay, what's going to be the most effective thing for you. And then it's as simple as we just start to have a conversation. We find out where the imbalances in your energy flow are, and we start to correct them. And the goal is to relieve whatever the problems are that you're having. Now, I don't claim to diagnose any illness or to treat any illness. Really what my goal is to help you find out where your energy blocks are, be it pain, be it depression, anxiety, and then to open up those blocks to allow the energy to flow freely. And as we do that, you start to get well. So I hope you'll look over the site. If you want to know more about my healing story, it's here. And please contact me by simply emailing me. My email address is here. And you can also page me. My pager number is on the site. Feel free to page me, and we can talk for a few minutes and take a look at what's going on, and then you can decide, is this something that you might be interested in? So, again, welcome to HopeMD. I'm glad you're here, and I hope to talk to you soon. Bye-bye.